Once you get vaccinated, your body identifies that as a foreign protein. One of the lymphocytes that makes that antibody begins to make it, and when it's no longer needed because the threat is gone, the antibody levels go way down. But your body has what are called memory B cells. B cells are the lymphocytes that make antibodies, and our bodies are loaded with memory B cells for whatever we've been exposed to in childhood. And so so measuring an antibody level, it may be low in someone that either has had natural disease or had the vaccine, but as soon as they're exposed to the live virus again, their immune system sees it, those memory B cells kick into action and antibody levels go up very rapidly and you're protected. I was fully vaccinated with the Moderna vaccine, like most of my colleagues here, among the first because we're healthcare professionals. And then I had my usual seasonal cough and sneezing, which I always get every summer, but just to be safe, I got tested for the coronavirus and I was positive. I wasn't sick at all. I can guarantee you, had I not been vaccinated, that I would have suffered serious illness and possible death from the coronavirus because of my age, because I'm on immunosuppressants for my rheumatoid arthritis. I'm in a very high-risk group, but I was protected. And that's exactly what we see among our patients admitted to the hospital. One of the most memorable cases I saw was a man in his mid-60s who had widely metastatic cancer and came in because he had nausea and vomiting, and he tested positive for COVID. But he didn't even require nasal oxygen. His chest x-ray didn't show anything. And I asked his wife, hey, you know, he should be among the people that get the sickest if they get the coronavirus. Has he been vaccinated? And she said, yeah, he got the Moderna vaccine right after it came out. So here's a perfect example of how the vaccine protects even the sickest people. Now, and so because of the advent of the Delta variant, which is much more transmissible and causes more serious disease, the scientists are trying to figure out how do you decide who to revaccinate as the immune system gets weaker or wanes. And originally they were saying everyone should get a booster dose. And they've kind of backed off that because, and their recommendation now is just that people who are at high risk, people on immunosuppression because they have a transplant or they're getting chemotherapy should get boosters. And we're waiting to see if boosters are going to be required in the rest of the population. But it certainly doesn't mean that the vaccine doesn't work. The vaccine works better than any vaccine that we've ever had available to us to keep people healthy.